Breast self-exam is when a woman does her own breast examination to assess whether or not there are any abnormalities present. There was a time, decades ago, where we recommended that women do breast self-examinations every month. We have since moved away from making that recommendation, though we will discuss with women how to do a breast self-examination so that they have breast self-awareness. In case there are any changes, they will be familiar with their breasts and know when to bring something to the attention of a healthcare provider. It would start by a woman placing her hands on her hips, undressed from the waist up, and looking in the mirror. They are looking for symmetry of the breast. They're looking at their skin to be sure that there are no skin changes, redness, darkening, nipple changes, dimpling of the skin, swelling of the skin, retraction of the skin or nipples. The woman would then raise her arms over her head, again looking in the mirror for similar changes. She would then lay down either on the bed or on the floor, placing one arm over her head. She would place the arm over her head of the breast that she would be examining. So for example, she would place her right arm over her head if she were going to be examining her right breast. And with her left hand, she would begin the breast examination. We typically recommend that women start all the way up at the collarbone because we have breast tissue that extends all the way up there, although we don't think of that. We recommend that they also examine all the way up under the armpit because we have breast tissue that extends into the armpit. It extends all the way to the middle of the chest and the sternum and all the way down to the top of the abdomen. And they would start at the top and with circular motions of the balls of their fingertips, making concentric circles until they reach the nipple area. When they get to the nipple area, they should then press the nipple between the first two fingertips to see if there's any nipple discharge. After they've completed one side of the breast examination, they would go on to then do the same on the other side. We would also recommend that women do the same with standing, because when they stand, the breast tissue falls differently. It should only take about 15 minutes or so to do a breast examination. Doing breast self-exams does not replace a mammogram. A mammogram is really the screening modality that's recommended. However, there are many women who are diagnosed with breast cancer who will be the first to notice that something has changed. Anything that a woman discovers that they feel is different or unusual, or they question or they're concerned about, should really immediately be brought to the attention of a healthcare provider.